Hello there, my name is Lamin Jai, and this is a special interview. So tomorrow, that's Sunday, or Saturday rather, the Gambia will join the rest of the world to mark this year's remembrance of victims of road crash. Road accidents is something that has proven to be a very important issue. Annually, a lot of thousands and thousands of people die in road accidents. So I have officials of the Gambia government, but not just that, officials of since it's also a health issue, I have officials of the World Health Organization. I have two officials actually, one from the Ministry of Transport, Works and Infrastructure, and Mr. Maudu Gassama from the World Health Organization. They are joining me. They were initially billed to appear on News Review, but that couldn't prove possible. So they are here today to discuss about road accident or road crash and the victims, people that die in road accidents, basically ahead of the event tomorrow. Gentlemen, thank you for appearing on the Fatu Network.
Thanks for having us.
Thank you, Mr. Drame. That's Mr. Esa Drame, the Director of Planning there at the Ministry of Transport, and Mr. Umar Gassama.
Thank you very much.
An official of, senior official of World Health Organization. I'll start with you. This year, the Gambia government would lead the efforts in marking this year's International Day for Remembrance of victims of road crash. Can you run us through how it has been like in terms of the number of people that die in road accidents in a year or annually, if you like?
Thank you, very much, Mr. Lamin. Road accident is really a serious, issue, not only in the Gambia, but globally. Globally now, we are looking at 1.35 million deaths, annually, and then nationally in the Gambia, we are looking at on average about 115, but in total, you have over 700 road accidents, that occur. So that is quite a lot, looking at the size, of the country.
That's a lot, looking at that. But at the level of the government, because one could, argue that road accidents really, most of these cases or most of the times are avoidable. What is leading to the rise in the number of road accidents in the country?
There is a combination of factors that lead to road accident. That's why the government is cognizant of this fact. That's why we adopted this strategy for the Gambia, road safety strategy for the Gambia, which is 2021 to 2030. So this strategy will look at the key issues the critical issues that are affecting road safety in the country, and then we'll set ourselves target that we should achieve, and we came up with a number of strategic direction, basically about 8 strategic directions. We believe when we pursue these strategic directions, we will be able to improve the situation in the country.
Briefly, can you run us through that as to the strategies?
Yeah, sure. If you look at the key strategies that we look at at the first strategic direction that we want to take is to look at the leadership and the institutional framework, because this is very important. Globally, it is recommended to have what you call a lead agency for road safety, because in Gambia currently what we are facing, you don't have a specific institution that is responsible for coordinating or promoting road safety. When I say you don't have, because the ministry is acting that role, but we don't have the legal backing or the adequate funding in place to do that. But the Ministry of Transport is currently taking that role. But what needs to be done is to have a lead agency. What is even recommended is to have a dedicated one outside, an independent body to do that. And another issue that we currently have is the capacity building. That's the strategic direction that we want to look at, because if you look at when you go to the police, you have quite a number of capacity problems. When you go to the engineering issues, you have what you call these road safety audits where, you know, the engineers, you know, will look at, you know, various, you know, areas which are critical, that we call, you know, black spots, and try to, you know, address that. All those things, you know, we are not currently conducting, you know, those issues. And another one is have to do with the issue of, you know, the legislations, because currently, you know, the legislations, you know, that we have in place, you know, they are not very adequate. Some are, you know, obsolete. So there is a need to comprehensively look at, you know, the legislations, and then we do this target, you know, enforcement, which, you know, we should, you know, strengthen. And another area is to look at, you know, facilities, you know, for, you know, pedestrians, because if you look at now, you know, the nature of our traffic, you have mixed traffic. You have both the vehicle and
pedestrians.
the pedestrians. So we need to kind of, you know, have, you know, dedicated, you know, lanes, you know, for the pedestrians and the vulnerable, you know, road, you know, users, whereby, you know, the vehicles and then the vulnerable road users, you know, will be separated. And another area that, you know, we want to, you know, look at or to improve is the area of this post, you know, crash, when the accident occur. What, you know, needs to be done, because, you know, currently, you know, we have the Red Cross and then the emergency, you know, service at the RBTH, you know, that do that, but, you know, it's not, you know, very effective. So we want to look, we want to strengthen, you know, that aspect.
Okay, I'll thank you. I'll now turn to Mr. Gassama. I want, because you are representing World Health Organization in all of this, but can you tell us really what makes the issue of road accidents a health issue, a health problem, if you like?
Thank you very much, Lamin. I think my brother has said it very clearly. Road safety, I mean, is a global public health problem. Now, he talked about the number of deaths that we have on the roads, which is roughly, like he said, 1.35 million. It's not about death alone. It's also about injury and also, you know, all the necessary, you know, hazards that surround, you know, a road crash. Injuries, the records we have is that apart from the 1.35 million people dying every year on our roads globally, we also have between, you know, 20 and 15 million people who are injured. And some of them are seriously injured. And you can imagine, if we want to understand the impact of road safety, just look about a breadwinner. You leave your home, you have five children, you have a wife, you have a brother, you have a sister, and you leave home. You are the sole breadwinner, and you leave home only to be told that you had an accident. Although luckily you survived, but you are retired to a wheelchair. Now, this is where the challenge lies. When you retire to a wheelchair, then automatically your productivity declines. And when your productivity declines, this affects the family. So if you look at all this, and then your contribution to your family is declined, but also your contribution to the economic activity, the economic productivity of the country also declines. Say that person is an engineer, for example, or a surgeon, you know, or a very good tailor who is, you know, contributing a lot to economy, you know, social. So if that person is retired to a wheelchair, for example, you know the impact. So it has beyond the statistics, beyond the death, you have a lot of human sufferings. What about the trauma, the psychological trauma? You lose a very dear person, whether it's a son or a daughter or a friend, and you see the photo. Can you imagine? Every time this thing really, you are traumatized. And socially also, so that is why the World Health Organization or United Nations sees, road traffic injuries as a global public health problem, looking at all these dynamics. Now, if you go beyond that, if you come back to why are we celebrating this? This is why it's all about within that context of being a global public health problem. And this is the reason why we are having what we call World Day of Remembrance for road traffic victims, people who really suffer from this. So the rationale is, as I said, is very clear that it's a global public health problem. But the reason for it is to critically awaken global concern, global perception, global thinking, about road traffic crashes. We don't even call it accidents. This is not even in the literature now. Because if you look at road traffic, what we call road traffic accidents, they are road traffic crashes, injuries. You shouldn't even call them accidents. Why? Because over 90% of, about 95% of road traffic crashes are human error, due to human error.
Yes.
So what do you call it now?
And can be avoidable.
It can be avoided. It's avoidable. So this is what we call avoidable deaths and injuries on the road. They can be avoided. So which means that now there is something wrong somewhere. If you look at the dynamics again, the bulk of the road traffic deaths are in the developing countries, low and middle income countries like the Gambia. And these low and middle income countries, in fact, only represent nearly a little bit about 50%, of global road, transport. Whilst the industrialized world only constitutes only few, I can say the majority of the vehicles are from the developed countries, but they only have few accidents if you compare to the developing countries. So where are we? It means that something drastically is wrong. That's why he brought all those strategies, because it's a complex issue. I think that has to be understood. It's the most complex issue that you can deal with. It's the most complex public health issue, because it's not one size fits all. You don't only look at one area and then leave the other. For example, people may think, a lay person may think, oh, this is a driver, it's a problem with the drivers. It's a problem with the drivers, so I'm not bothered. No, you are bothered, because the essential pillars, WHO, UN, says there are 5 essential pillars that they have to work together. One of them he has mentioned about management, road safety management, and that management also you need to have a very comprehensive strategy for that. ENSA has unpacked that. The other one is, of course, the road itself. There must be safe movement. The road itself should be good. And of course, what we also call safe vehicles. The vehicle must be safe also. And if you have a lot of issues surrounding safer vehicles. You go into so many things. He has mentioned some of them. And also you need to look at road safety, user behavior, safer road users. The road users should also be safe. Who are these road users? He mentioned some of them. Unfortunately, our roads in the developing countries is multi-purpose. Meaning that every road, motorized and non-motorized users they all share the same road.
Yes.
Now, donkey carts, bicycle, motorcycle, you name them. So we need to also look at cater for the need for road safety. Road users. If you look at this, if you look at our country now, the bulk of the people who are involved in road traffic crashes are vulnerable road users. Either they are pedestrians, they are motorcyclists or cyclists. Yes. You are either walking, or you are riding a bicycle, or you are riding a motorbicycle. The bulk of of course, you have other people who are really affected. People, car occupants, vehicle occupants. They are there, but the majority of them are this. So what is happening now? If you don't cater for them, we have a problem. So you can see the dynamics, and then of course he mentioned the last one is post-crash. We also we should have a system in place where we will have to accommodate, that road traffic crashes must occur because it's human error. They must come. They must happen. So what are you prepared at the level of the hospital to help those victims so that they survive? And that's why ESA has mentioned. So you need to prepare that. You need to have the specialists there, trauma specialists. You need to have the equipment. You need to have the resources, both human and material, in place to make sure that, you are prepared for any emergency of that nature.
Now as a WHO official, aside, building concern around the issue of road crashes, what other, can you tell us in terms of the role WHO plays in all of this?
Thank you.
Yes.
In fact, the United Nations as a body, because WHO is a specialized agency of the United Nations system. Now, United Nations as an entity has what we call United Nations Road Federation, a very big, committee, and that committee WHO cares it. So WHO cares to that. Of course, you have other United Nations agencies involved in it. Why is because of its comparative advantage, because WHO is the global authority on health.
Yes.
And health is not only hospital. Health is beyond, if you unpack health, is beyond hospital. Is you have the physical part of it, you have the mental part of it, you have the social part of it, and you have the, of course, the
financial part.
You name them, you know, disability, you name. So health is so big. Now that's why WHO is charged with that responsibility. Yes, UN has this entity there, this committee. WHO is giving the care. So WHO's role, our mandate now is, we are not a supra organization, meaning that you have to parachute and dictate people. No, 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 no. WHO is an intergovernmental organization, but it's a technical organization, and its mandate is to many things. Is to, of course, coordinate global health, but at the same time, it has the mandate to strengthen systems in place, governance systems, health systems in place, and health system is also very broad. So our role is to prepare countries, give them the science they need, which means the evidence they need. And now when you give them the evidence, you also support them in translating those evidence into policies and strategies. And this is what you're talking about. All these pillars that we're talking about, they are you know, evidence-based pillars. You know, evidence, science, there has been research on them, that this is the way to go. When you do this thing, automatically you can reduce, you can reduce the death or the injuries on our road. A good example, for example, if you reduce, for example, what science say, experts say, if you reduce, you know, like, you know, speed limit, if you reduce where you have a speed limit, and if you reduce by 1%, yes, you can reduce road traffic accident by 4%. This is science. So where is this science coming from? There has to be an organization responsible for this. So WHO's sole mandate is to bring the science on the table, help countries to strengthen their governance system by giving them the advice they need, and also, of course, by helping them prepare those plans, those strategies, those policies, those regulations. So WHO's role is all in the you know, at a strategic level. But operational level, government they have the answer now, because we are not supposed to be going and like going to the farm and, you know, and cultivate crops. World Food Program will, or FAO will not do that. So it's like a same thing for WHO. So all we need to do is to prepare the countries, give them the science, and, you know, translate the science into policies and plans to help governments to, to prepare their nation, to protect their nation, to promote whatever you want to promote. That's what we do.
That's what you do.
So it's a very, that is a question that can be taken the whole program.
Yes.
But just to summarize what we do, you know, so that you have.
I'll turn to Mr. Draman now, Director of Planning and Planning at the Ministry of Transport there. I mean, the government is leading this effort there to enhance people's level of understanding in terms of road crashes there, and the number of people that are dying. I mean, can you tell us, because I know it is celebrated, or the day is marked the 3rd, that's or the 3rd Sunday of every November. This year you are looking at celebrating it in a different format altogether. Can you take us through that?
Thank you very much, Mr. Njai. This day was celebrated some 27 years ago. It was first celebrated in UK, and in 2005 the UN adopted it as a resolution, and in 2008 that's when many countries, you know, started, you know, celebrating it. But unfortunately, or fortunately for Gambia, this is the first time that we are.
The very first time, really?
Yeah, this is the very first time that we are celebrating it. And then the essence of, you know, celebrating this day is not to remind, you know, the victims the pain, you know, the grief or the suffering, you know, that they have, you know, undergone, but it's to empathize, you know, with them, to show them that, you know, we are in it, you know, together, and then also to bring the issue of, you know, road safety in the limelight, the consequences, the cost, like, you know, Mr. Gassama was saying. In the developing countries, it is estimated that the cost of road, you know, accidents is equivalent to almost, you know, 2 to 3% of the GDP. So when you want to quantify that, maybe in the Gambian dollars, it's about, you know, $2 billion. because you have direct and indirect causes. The direct causes are the ones that you incur. For example, if you are involved in an accident, the hospital bills and then things like that. And then the indirect ones are the pain, the grief, and the sufferings that the families do undergo. And then this loss of earning. Can you imagine a productive man just involved in an accident?
Get incapacitated.
Incapacitated or what? Even the case of an injury is even sometimes worse, because that one is not only the loss of earning, but you add additional costs in terms of the medical expenses or things like that. So it's like to bring the issue to the limelight, and then some of the actions that can be taken in addressing it. Like you said, most of the accidents are preventable, but what is our response? What is the government doing, or the civil society or the private sector? That's why at the level of the ministry, currently what we have, we have a road safety committee, which is chaired by the minister, and then we have the working group. The composition is a wide range of stakeholders. You have even the petroleum companies are there, WHO, they are part of the committee, and then whole lot of things. So it's like we all come together to celebrate this day. So it is going to take in a form of a march past from Africell 10 a.m.
Sunday.
On Sunday. We will march towards the traffic lights, the Standard Chartered building. That's where we will converge, and then the speeches will be given. And then we will have some testimonies, from the victims, themselves. And the Honorable Minister of, Interior, will give the keynote address. And then as part of the celebration, we will be given some sort of, gift as a kind of a gesture. We have, some crutches, that we will be giving out. We will be giving almost 80, victims, each a bag of rice and oil. And then we will also give them, cash as a contribution, towards, their medical expenses. And from the commemoration, or as part of the commemoration, we will proceed to Edward, Francis Small Teaching Hospital. As we are speaking, we have about, 30, patients who are there as a result, of, road accidents. So we will go there also and then give them some cash, as a form of a contribution, towards, their medical expenses. So like I said, this is like a collaboration between the government, civil society organizations, and then the private sector. That's why, if you ask, where the money is coming from, most of, or the bulk of the money is coming from the private partners, that are part of, the working group. And of course, the government is, doing its quota as part of, the contribution. As
part of the contribution. Yeah. One thing that has always been out there, I mean, you are the Minister of Transport official. Yeah. One of the things that would normally get peddled when it comes to road accidents. I mean, accident is a word that people are trying to steer off nowadays. But road crashes has to do with the condition of our roads. Yeah. They claim that our roads are not very good. They are not fit. Sometimes the roads are very small. Sometimes the roads are filled with potholes. Sometimes really the roads, even the signing of the road, the signs are not there. So really that is what put a lot of drivers in trouble. Is this really, what do you have to say about that?
That is the notion that we are trying to get rid of. Because like we said, the issue is complex. Let's just face the fact. Even if you have world-class roads, accidents will occur. So it's like the onus lies more on the individuals, and in addition to other factors to avoid accidents from happening. Every now and then people whenever accidents occur, you will hear them saying, oh, the police are not doing their job, or the National Roads Authority, the roads are bad, or what. But like Mr. Gassama said, almost 95% of road accidents are as a result of human error in one way or the other. It's like we contribute to the problem. That's why it's my responsibility, it's your responsibility, and everyone out there to have the knowledge that we have to be cautious. when we are using our road. So it's like
so it's about being cautious, because for example, if you want to drive to Basse in the night, for example, sometimes can be a nightmare.
Yeah.
You don't know, sometimes these accidents are even caused by animals. You have stray animals that would want to cross the road, and if you are not careful, an accident would happen.
Yeah, that's why Mr. Gassama highlighted the 5 pillar areas. The first one, where you have to look at the institutional management. That's where you deal with the leadership. There should be an institution in one way or the other who should be accountable at the end, and then they will be responsible for the promotion,
the advocacy,
advocacy, and then to monitor whatever measures that we are putting in place.
So is the government contemplating coming up with something like that?
No, we have a strategy, and then is a strong recommendation to have a dedicated road safety body. For example, in Nigeria, at some point they face serious road safety problem. But when they came in, they established a dedicated body. They call them Federal Road Safety Corps. Those that corps they have an annual budget of about $80 million, and then now we are seeing improvement in that. So it means it's not just keep. It's not about talking. It's like action needs to be taken. In terms of legislations, we need to improve on them. And then, obviously, there should be funding. Because, if you go to the police currently, for example, even a mere speedometer, the speed guns, yes, they don't have. The breathalyzers, they don't have. If you look at, our laws currently, we don't even have this blood alcohol, level. So how would they prosecute you? So it's like it's a combination of whole lot of issues that needs to be addressed. And if we are to be serious with that, we need to have a dedicated body to deal with this new enemy that we are confronting.
So Mr. Gassama, to turn to you, because what very much is also clear has to do with the fact that a country's health system is very much involved when it comes to road crashes, because when people die or when people get injured, the very first place that one would take them to is the hospitals. Yeah. And in our part of the world, Gambia, for example, sometimes the healthcare systems really is a problem. So at the level of the WHO, in your opinion, what are some of the things that can be done in terms of WHO working with our country's healthcare sector in terms of strengthening up? That way people can access the healthcare that they need because since these accidents would always occur.
Thank you very much. This is a very good question. You see, WHO has prepared a package of essential interventions that countries can look at, what we call post-crash. What should be in place to help those victims, those people who suffer from injuries. Because at the end of the day, it should be that nobody should die. The ideal thing is zero. Like our mission is like Sweden, what is it? Zero death, meaning that nobody should die. Although accidents will occur, but nobody should die for accident. That is a very big determination, but it is also possible. But you cannot succeed in doing that without addressing the emergency system. So a whole lot of things are there. First is you have to, at the scene of the accident, or call it whatever you want to call it, the pre-hospital care also is important. What happens most of the time when there is a crash on the road, bystanders who are really genuinely helping, but there are times whilst they are genuinely helping, they are also causing, sometimes they cause havoc. They add salt to injury because the way they handle people they don't know, they are not trained, for example, how to do even mere first aid. So that's one of the critical essential pillars or essential strategy that WHO recommends to countries. Pre-hospital care. Then when you are able to get a lot of people trained on that, even the drivers, you name them, all different categories of people. When they are trained, they will be able to deliver help at the scene of a crash. that will really help a long way in saving the life of that injured person before that person is transported or on the way being transported to the hospital. So when you go to the hospital, there must be a system in place, a very robust system, emergency medical care system in place that is all encompassing, where you need to have trauma specialists. I don't know how many of them we have here, but I know it's very limited. Trauma specialists, meaning that people who are specialized, the WHO has produced a training module of that. You know, some universities are using them. You know, that you can train people on trauma care. But if you don't have trauma specialists, you need to also have nurses or, you know, medical attendants who have that training capacity, because it saves lives. So trauma, that system also, as I said, human resources are there. But again, the equipment also must be in place, because where you need some sophisticated equipment that you know to be able to handle critical injuries, some critical injuries. If you don't have them, you may end up going to Senegal, for example, or another. You fly them to Europe because you don't have the human resource capacity, and also you don't have the infrastructure, or you don't have the equipment to be able to handle that. So that is what you call an emergency, a comprehensive emergency care system. From the word, once somebody is brought by a vehicle, ambulance, and then, you know, that timely attention given to the patient is also very critical. It can save life, because the more you delay in addressing or in treating injured people, the more likely people will die. So a system should be in place where, you know, immediately there must be, you know, I mean, a system where people are taken care of as soon as possible. And that's why WHO is recommending within that system also to have one toll line, so that the whole country is sort of like when you say the 1025 for COVID-19. I think everybody knows that. So there must be one toll line for the whole country should know. When there is an accident or whatever, you call that line. I don't know whether I don't think we have that.
So, an accident line? Do we have an accident
exactly.
line?
This is what you have. This is part of the comprehensive system. And I'm glad Esther has mentioned all these things are part of the strategy that we are talking about. You know, the hospital itself should be well prepared for injured people. So that's what WHO recommend. Of course, the training, capacity building, you need to incorporate capacity building. Capacity building in terms of training here and abroad, and also at a strategic level, you need to, like, it's high time maybe now our university curriculum, you know, also looks at road safety, like trauma. You know, there could be a module on trauma care, you know, that our medical students can go through, you know, and then have some basic ideas before they graduate. I don't know whether that's happening, but this is something, of course, you know, I mean, our students are exposed to different aspects of medicine. But what I'm saying, this is a special care that you need, you know, for any hospital to be effectively running emergency services. That's why we are seeing a lot of cases that are moved from our minor health centers, our major health centers, to referral hospital. In fact, sometimes they even take you cannot go to you cannot even handle it in SL, for example. Oh, this person has to go to Banjul, or has to go to Serakunda. You go to Serakunda and say, oh, no. It has to go to Banjul. All this is telling you there is something missing. There is something missing in those facilities. Yes. So those facilities should be strengthened. That's what I'm saying. The health system is important. You need to strengthen the health system. And one way of strengthening the health system is to build the capacity, to strengthen the capacity, both human and equipment-wise, medical supplies, you name them. So this is what we call a comprehensive, you know, emergency care system that has to be in place, looking at all those parameters. And each of those elements are as important as the other. So you need to have a system that is, you know, not a parallel, but a system that is like complementary. One helping the other, one helping the other. You don't only have to look at one. If you forget about the trauma specialist and you have the equipment, you have a problem. And if you have the trauma specialist, you don't have the equipment, you have a problem. If you don't have an emergency system in place, you have a problem. In fact, that's even more of a problem. So this is where WHO is coming in. That's why I'm saying our mandate is to bring the science around the table, so that countries can use the science to prepare their policies, their legislation, their strategies, their plans. So that, I mean, all they need is to use that and then, I mean, enforce them. Because one thing also, Ensa mentioned, is enforcement also is important. How do we enforce? Because some of these behaviors they are like, I give an example where I was in a vehicle taxi. I mean, the driver was speeding and I saw somebody, that's a pedestrian. He was hooked on the mobile. He doesn't even know what's happening. He said, be careful. This person doesn't even know the car is coming. You can knock that person if you're not careful. And the driver had to slow down. And we had to gently talk to the man and say, oh, please, this is the road. You never know, for your own safety. You are on the phone, texting. I mean, what do you call it? I mean, maybe he's doing WhatsApp or whatever. Completely forgetting about on the road. That he was on the road. So that's why these are some of the, I mean, this is the human error. That's not only driver, like I say, is saying. The human error also on the part of the road user. Because my safety is number one first, before any other person. So if I see a driver misbehaving on the way, if I'm careful, I will give myself, I'll run away. Yes. So these are the things that, as just to sum up, that WHO recommends for countries. The health care system is very important. Because like you said, when people are injured, they are taken to hospital. Are the hospitals ready? That's the question mark now. I know they are doing a good job because they are saving lives, but there is always room for improvement. Room for improvement for third world countries like us. So you cannot have a perfect system. Even the developed countries, they also have their challenges. So every country has their challenges. So the Gambia is no exception. All we can say is there is room for improvement. There is good job being done because barely people survive the crash. Some people will think they will die in accident, but when they go to the hospital, Edward Francis and other places, thank God you see them alive again. Although maybe they are retired to a wheelchair. That's not a problem. As long as your life is safe, that's it.
So Mr. Drame, I just want to ask you whether at all there is any record at all at the level of your ministry in terms of, in the Gambia, the number of men that drive far outweighs the women, their women counterparts. But this claim out there that women are more inclined to drive carefully than the men. Do you have like the statistics as to the number of, because almost 200 people die annually from car crashes, over 700 accidents. So, but these accidents, who are the people that cause these accidents? Are they men or it also includes women?
Yeah, I cannot tell you the exact percentage, but I can tell you that most of the victims are male, and the unfortunate part is like the vulnerable road users, which account for about 40%. This is a class of road users who are pedestrians, the ones using bicycles.
So these are the people that die more.
About 40%. This is unacceptable. It's unacceptable, and then all efforts need to be put so that we can make a stop to it. That's why if you look at one of the strategic direction is like infrastructure improvement, focusing on the pedestrians. It's like facilities need to be provided so that they can be at least safe from this road crisis.
How about those that are most of the time inside commercial vehicles, gele-geles, commercial vans, these buses, mini buses, and then there will be a car crash and all the occupants would die? How about, do you have statistics as to how often that happens?
Unfortunately, one of the problems that we are facing, and as part of the strategic direction, is to improve this data collection and analysis. And the starting point is where the accident data is collected and how it is collected. Because currently, if you look at the template that the police are currently using, it's not comprehensive enough.
Yes.
You have a lot of missing variables there. Because I was over the years, I'm the coordinator for this global status report data collection, which WHO do in collaboration with the countries every 2 years. But one of the challenges that we have is like you have a lot of missing variables. For example, if you want to look at death by age, it's not just there. like, you know, the conditions of whether it's daytime or it's nighttime, you know, some of those things, you know. That's why, you know, for us, you know, we want to work, you know, with the police, because at the level of, you know, West African Road Safety Organization, they develop a template, a comprehensive one, and they're encouraging, you know, countries, member countries, you know, to adopt that. Currently, you know, we're trying to engage, you know, the police so that, you know, we can improve on our accident data collection, you know, procedure. And even if you look at currently, you know, the way even the police are collecting, you know, this data is still, you know, manual. They need to graduate, you know, from that. And also the way the data is also collected is not coordinated. No. Bulk of the data, you know, is from the health centers. But how do the health centers, you know, coordinate, you know, that you know, with their statistics, you know, with the police? Currently, you know, it is very poor. And when you go to our legislation, also we have a challenge there, because I don't see anywhere where, you know, we define what a road accident that is, or road crash, you know, that is, because the international recommendation is like 30 days. Some they use, you know, 72 hours. Some, you know, they go, you know, beyond that. Yes. But for the Gambian, you know, that one is a challenge, because so currently what is happening, for example, you know, if you are involved in an accident and then you go to the health, you know, facility, and then you are treated, you think, you know, is a minor something, yes. And then you go within 1 week you die. Still, you know, you died as a result of, you know, road accident. But how is, you know, that data captured? So there is the need, you know, to, you know, improve our data collection and, you know, the overall management, and then the coordination between the health facilities, the police, and then the Ministry of, you know, Transport. So we see this as, you know, sort of a capacity building challenge, and then we are ready as part of our strategy, yes, to capacitize, you know, the police, you know, to improve on our data collection and management procedure in the country.
Mr. Gassama, do you have a final?
Yeah, thank you. I think the final word is our statistics are showing, they're very clear that most of the accidents occur between 6 a.m. and 6 p.m.
Really? Interesting.
Yes, good percentage of accidents. So, and a good chunk of that also occur in the weekends. So we need to look at that. And like the question you posed to Esa is that if we look at globally, I mean, 73% of, you know, accident victims, or what you call them, whatever you want to call it, 25 years down. These are young people. And that 73% of them are male. So it's all about exposure. So men, for example, are more exposed to traffic than women. It's happening everywhere. Globally, there are more men die of road traffic accident or crashes than women. So that is a global phenomenon. And there are many reasons for it, of course.
Is it because men are more than women, or it is men that ply the road?
Let's do an example now. Even if you don't know, hypothetically, yes, if there are 100 drivers in the country, yes, what your own observation? How many of them will be men and women?
I think men are more than women.
That will tell you a story now.
Yes.
So you have more men driving than women. Of course, women are driving now, but that shows that, because then I'm telling you about the exposure now to the traffic. Yeah. Because the more you drive, then the more you are exposed to the danger. So women are driving less, so they are not less exposed. Of course, the pedestrians, women also are there.
How about men being careless drivers?
Yeah, you see, that one again,
women can be very careful when
there
it
could be
comes
some studies to be done on
that to really see.
That's a good question.
To really see whether men are driving carefully enough. I add the word enough.
Absolutely right. Yes. I'm told, like, even casual discussions, you say, women are more careful when they're driving than men. Yes. So, well, this is our subjective analysis. So, it may not be the real picture, but what needs to be done is to have a comprehensive science available, which is, meaning that,
that would be a research or
something like that.
Thank you, Mr. Gassama.
Most welcome.
Mr. Drame, before we end the interview.
Yeah, what I want to say is, like, it's time for action. Because Mr. Gassama can, bear with me. we started, this journey a long time ago. I can remember as far back as, 2008. Since, we formed a committee, a road safety committee in the Gambia. But not much has been done. And then I'm glad that now we having some sense of direction.
After how long? 12 years?
It's not easy. It's not easy because we say it's complex. When we say it's complex, you will not know it unless you are involved in it. That's the time you will understand the complexity. What I'm telling you now, we have a direction, and then we are ready to improve the road safety situation in the country. And of course, this is everybody's responsibility. It's not only about government. It's about private sector. It's about the civil society organization. It's about the media, especially the media. You have a bigger role in terms of sensitization, because the statistics you already heard about it. About 95% are as a result of human error. How do we sensitize people? How do we make people to understand the danger they are exposing themselves to? So, everybody have a role, to, fight, this menace, that we are currently faced with. And I can assure you that at the level of the government, we are doing our best in partnering, with the civil society organization and all other key stakeholders in the country to ensure that, our roads, become, safer.
Thank you very much. Director of Planning there at the Ministry of Transport, Works and Infrastructure, as well as Mr. Modu Gassama, World Health Organization official. They joined me today to talk about the International Day for the Remembrance of Victims of Road Crash, which will be celebrated or marked next Sunday. That is this coming Sunday. That is it for this interview. Thank you. Until next time. Goodbye.